Hello, everyone. Welcome to The Social Doctor, and this is Dr. Ayushi. The Social Doctor is a platform for the doctors by the doctors, where we discuss journeys, experiences, and knowledge from successful medical practitioners. And today we have a very special guest, Dr. Bablesh Mahawar. She is a pain medicine specialist currently practicing in Raipur. She is here to discuss about her journey as a pain medicine specialist. Why did she pick up pain medicine as her specialty? What are the kind of challenges and opportunities she has gone through in her career journey and is still on that journey? So welcome, doctor, to the platform. It's really nice to have you here.
Thank you so much, Ayushi, for your nice words. And I'm really grateful to be a part of this forum. Thank you so much.
Thank you so much, ma'am. In fact, it's lovely to have you. So, ma'am, just wanted to, understand a brief, about your journey. How did you start your journey? And, why was your inclination towards pain medicine?
Almost around 15 years back when I did my anesthesia. Anesthesia is also a very good branch. Then after a few years, I realized that this is not giving me that much kick. Because anesthesia branch is mostly behind the curtains, but the things have changed post-COVID time. And the anesthesia branch has been recognized in a bigger way. And anesthesia and critical care are really very good and special branches. But in my case per se, when I did my anesthesia and critical care, I just found that something is missing. And I just moved towards the searching for the other opportunities. And then I explored so many things. And then I went to Delhi Pain Management Center, Dr. G.P. Tureja, who is one of the founders of the pain medicine specialties, Dr. Bhattacharya, Dr. Gautam Das in Dradia, Kolkata. And I started gaining knowledge, and I found it to be very interesting and very challenging. And that gave me a lot of satisfaction, because dealing with a OPD patient, when the patient comes to you in pain, and you just try to counsel them, try to give them a conservative management with some other interventions, and try to just diagnose the pain generator, that why the pain is coming, because it's keep on poking your brain again and again. So I found it personally very interesting. And my teachers also made pain medicine. They taught us in a very interesting way also. So that is why my interest grew up a lot. And I stopped my anesthesia. I just left my anesthesia almost 11 years back, and then switched over to pain medicine branch.
So, it's very interesting to know, to understand how do you made that switch after so many years. Now, understanding now when you plan to make that switch, you have done a lot of courses and fellowships. Thoda sa agar aap bata paye, what are the kind of, firstly understanding what are the kind of best courses that, if somebody is interested in India, who can go for these kind of courses for pain medicine?
Nowadays, I will tell you, like MCI, the Medical Council of India, has recognized 3 years DM in pain medicine, which is a very big thing and a very big and good step by the MCI and the pioneers in pain medicine, that we have started DM in pain medicine in a lot of government institutions like AIMS, Rishikesh, etc. After that, DM in pain medicine, there are several PDAF courses also, which is there in SGPGI Lucknow. These are some 2 years courses. And then certain postdoctoral certificate courses are also there, PDCC, which is 1 year course in many renowned government institutions like BHU, Varanasi, and several other in Lucknow, and other institutions also. Certain non-government institutions are also there with multiple fellowship programs of 1 year, of 3 months. And even we have FIAPM, that is the Indian Academy of Pain Medicine, also recognizes and gives the degree for the pain medicine, which is of 1 year and 2 years, in several other non-government institutions also. But these are the university organized, recognized institutions. So several other are there in Lucknow, in Pune it is there, in Kolkata it is there, in Delhi it is there, in Bangalore it is there. So several other institutions are there. You can even search. There is a very beautiful article in Indian Journal of Anesthesia by the Journey of the Pain Medicine. So in case if you read that, so everything, each and every detail of every college is given, which is I think given by Dr. V. Rastogi. So each and every detail is there in that article.
Nahin, that's do let us know the link, ma'am. We will definitely attach to the bio of our description, in the description of this video. So now understanding, ma'am, there are a lot of courses that the government has also now, recognized with pain medicine. Apart from that, what are the kind of, fellowships that you will personally say, that kids should go for when it comes to pain medicine that you have also pursued yourself, if you can, recommend some?
DM in pain medicine is a new thing which has just come up around 2 to 3 years ago. So nothing is like that. DM is DM, and that is the one of the best and recognized by the MCI, which is a 3-year course. Then 2-year courses are also there, 2-year fellowship courses. PDCC is there, which is in various renowned institutions. It is there. Anyone can pursue these 2-year fellowships also. Even 1-year fellowship can also be done. 1-year fellowship can also be done in the various institutions. And I must say that there is we have a society, that is Indian Society for the Study of Pain, ISSP, and this ISSP also recognizes the IAPM fellowship, that is the Indian Academy of Pain Medicine fellowship. In case if you do from 1-year fellowship from any of the renowned institutions, then you can give the there is an entrance and there is an exit exam. You can give these entrance and exit exam, and you can get the IAPM degree also. So these all are the recognized in India per se, that the DM is there, PDCC is there, PDEF is there, and IAPM fellowship programs are there in various institutions.
And ma'am, when it comes to internationally, as you have done some courses in Europe and USA, if you can, just let us know about those as well.
There is a FIP course, that is the interventional fellowship and for the pain interventions. That is the best you can do it, which is by the WIP, that is the World Institute of Pain. So they have their own program, and they usually conduct this exam roughly around in September and October. And then we have in UK, there is a European Diploma in Pain Medicine, that is EDPM. This is usually there nowadays for the past post-COVID, for the past 2 years. They are taking the part 1 as a online exam, which is usually there in November. And then the part 2 you have to give practically there in Leuven or in Belgium in Gustafsburg University. That is roughly, it is there in about September or December time. So by pursuing that, there is a practical exam and theoretical exam. By giving that, you can get a EDPM diploma certificate also by UK.
Yeah. So now understanding about these kinds of fellowships that you have gone for, internationally. So, what do you suggest the Indian students who are planning to pursue this branch and, who think that they have a tilt on it? What is the first thing that do you suggest them to do something to understand more about this branch, or, because they are already in anesthesia? So what do you suggest them, anybody who is thinking to pursue this?
In my opinion, I must say that before going and entering into pain medicine, just go join a short course anywhere in India and just see that whether you are getting a kick or whether you are liking it or not. Because that is the platform for you. That will make you realize that whether this is suitable, you want to pursue this. Because so many times the critical care physicians are there. They like their brand so much because that should be there. So that is why the critical care physicians are different and the pain physicians are different. So just do a short course and just see, pat yourself and see that whether this branch is suitable for you. 15 days, 2 weeks, 4 weeks, 3 months courses are also available in various institutions. Just check it out before you go for further DM and many years of fellowship and postdoctoral courses. So just, I think, to go for a short course first.
Yes, yes. No, this is a very important, suggestion from your end, ma'am. So now understanding how can somebody pursue these courses, what are the kind of opportunities that come forward with pain medicine? This being a relatively new branch, especially in India, what do you what are the kind of opportunities available for students who pursue this branch?
This is a new branch, but it is a very beautiful branch, I must say. And there has been lot of work which has been done in the past 2 decades. And this is a very beautiful branch, although it is on a in a nurturing field right now. But still, so many things are there. And right now, in case if we say that so many job opportunities are not there in a corporate and government institutions, but still, when you are doing your SRship, you can learn about being associated with your in your college with one or two pain consultants, and you can see, because these are the challenges in the beginning, that independent pain consultant job in a corporate and government institutions are only few. In first tier cities, even in a capital of India, Delhi also, I think a few hospitals only has this kind of a job for a pain consultant. Rest, most of the people are doing a freelancing, or they have their own OPD and clinic setup. And government institutions are still, they have to increase their job opportunities in pain medicine. Yeah.
No, so now, ma'am, this can be the kind of opportunities and maybe challenges when it comes to pain medicine. So how do you suggest these students to get established? What is the difference of settling down in a metro, like you said Delhi, or in a small city, maybe tier 2, tier 3 city, for a pain medicine specialist?
I think it is always better to be associated with someone, because so many renowned pain management centers are there in Delhi. IPSC is one, Delhi Pain Management is one. In Medanta also it is there. So many other institutions. I'm sorry in case if I missed a few. So many institutions are there. So you can associate with one or two of the seniors. They can also guide you further in this field, because and then you can just start with your setup with a simple table and chair, as my teachers used to say, that you need a table and chair into the very beginning, because history gives the most of the clue, and you can assess your patient, you can diagnose, you can just come to the conclusion that what a pain generator is, how you can grade the pain, and then you can only manage the pain. So it is always better to be associated with someone in the beginning, so that you realize, you come to know about the pros and cons of the field and about the challenges, and then later on you can switch on to your own setup.
And this is very helpful of understanding, to aligning with somebody. But when it comes to settling up your own setup, you mentioned some of the institutes in Delhi. How is it, you have been practicing in Delhi for a pretty long time now, and now you're in Raipur. Raipur is also a very big city, but still there is a lot of difference between Delhi and Raipur when it comes to, people and the understanding of your patients. So how do you think it is different for you to practice as an individual, not associated with somebody, in Raipur, as well as now, initially in Delhi and now in Raipur?
I must say that, as I told you, that even in the capital of India, that is Delhi, there are few job opportunities only available in a corporate hospitals, and government institutions also, such kind of opportunities are very less. So when I moved from Delhi to Raipur, Ramakrishna Care is a hospital I'm associated with, and they have come up with a new concept of pain and palliative care clinic. I joined them, and then this is a very good thing that a second tier city has come up with such a beautiful concept, because pain medicine is not only the management of a post-operative pain. It is something more than that, because chronic pain patients are really challenging, and every fifth person today is suffering from such kind of a chronic pain. So pain clinic I think is the need of an hour, and each and every corporate and a government institution should have this. There are definitely challenges, first tier cities, second tier cities, but I think in near future these challenges will be less, and the growth will be much more in this field, because there has been a lot of work which has been done by our seniors also in the past 2 decades, and this will keep on going on.
Yes. So, there are, so just along with this, wanted to understand as a general, every branch has a different kind of lifestyle attached to it, a different kind of, work life attached to it. What is it with a pain medicine specialist? How does, what the amount of the kind of lifestyle, the challenges, or, the things during the day that goes through for a pain medicine specialist, if you can, ma'am, explain a bit.
I think seeing a patient in a pain OPD requires a different mindset. It requires a different humanitarian grounds in case if you are dealing with a cancer pain patients. It requires not only a 5 or 10 minutes job, it requires usually a 40 to 45 minutes job, that you put yourself into the shoes of the patient and their caregivers, and you ask the entire history, you see the challenges, you read the psychological concept, you see the emotional aspect, because the patient who has been suffering from chronic pain since years and years together has definitely an emotional and a psychological component as well. So just seeing in toto about this patient is not a 5 minutes job. It is not a 5 minutes job. It really requires half an hour to 1 hour to seeing a patient, and then only it gives you a satisfaction that you have seen a patient and their entire family in toto before you offer them any management or any treatment. So that is why I must say that history is very important, and giving time is very, very important key in pain management, because this is the new branch, this is a nurturing branch, and I think we should always give attention to our patient and their caregivers. And just putting an epidural and just giving some block is not pain medicine. It is pain medicine, means the medicine word is attached to that from the very beginning you have to go till the end, that recognizing what is the reason, what are the causes, where is the pain generator, and then in the last comes the intervention and the management and the drugs. So it is the entire thing you have to see in the due course of 40 to 45 minutes, and it definitely takes time, and it's really satisfying and a very beautiful branch to nurture.
Definitely, especially when you see your patient out of pain because of the, small, things that you have done, and seeing them happy definitely makes a lot of difference. There is a new term that has come in, in pain medicine, that is minimally invasive pain and spine interventions. If you can, ma'am, explain a bit around this.
Yeah, MIPSI is there, that is minimally invasive pain spine interventions. That so many times what happens is, because the old thought was this, that back pain is there, so that means some disc problem is there, and the patient needs to be operated. Nowadays, it is not like that, because in case if we see in the past also, for each and every heart problem, there used to be a bypass surgery. But now it is not like that. You can do angiography, angioplasty for the management of heart ailments. In the same way, for the back pain or for any other pain also, so many things are there. You can just find out the pain generator. You can see that from the complex spine structure, which part is causing pain, whether it is a facet joint, it is a nerve root compression, it is the ligament problem, it is the joint problem. So what is the problem exactly? And in case if you target that by the MIPSI, that is minimally invasive pain spine intervention, either with the help of an ultrasound, either with the help of a fluoroscopy, or with the help of a CT scan, and then and there you give the block, give the numbing medication, and the pain is just gone. So you can just imagine that you can save a life from a surgery, because spine surgery is not a small one, and you can even in elderly patients also, you can reduce their morbidity and mortality to lot many extent by these MIPSI interventions rather than they go for a surgery.
No, this is definitely a lot of help, especially the number of spine surgeries happening these days. I'm sure this will help. So now, ma'am, lastly, in something now discussing from your end to all of the students who are still confused about understanding about pain medicine, the graduates as well as postgraduates, something for the graduates as well as something for the postgraduates with anesthesia, something from your end, understanding about, something on pain medicine that you want to convey them.
First of all, I would like to say to the undergrads that pain medicine is not only the definition of the pain and the pain pathway, although it is very important, but still it is a vast subject. Just go and poke yourself and try to read a little bit more about the various pathways and the various systems, somatosensory and all that. And to the postgrads, I must say that just try to pursue, in case if you're a little bit confused after anesthesia, just try to pursue a short course anywhere, anywhere around India, and you can just find out that whether you are liking it or not, and then you can just go for the super specialization. You can go for DM, for pain fellowships, for PDCC courses. Lot many opportunities are available nowadays. Just explore. Yeah.
Thank you so much, ma'am. Understanding about pain medicine, especially, from an expert who has been practicing more than 2 to 3 decades and somebody who has been so deep into the branch, is really amazing. So thank you so much, ma'am, for coming on the platform and discussing about your specialty in depth.
Thank you so much, Ayushi. Thank you so much.
Thank you so much, everyone, for joining us today. I hope this thing really helps you to understand about pain medicine. Do share it with your friends and colleagues, because pain medicine is a new branch, still not clearly widely explored and clearly understood. So please do spread to the maximum friends and colleagues of yours for them to understand about this amazing branch. And being a new branch, if you are planning to do something different, this is a fantastic thing to do for you, being the first people in the race of pain medicine. So thank you so much, everyone, for joining. Thank you so much, ma'am, for